Good afternoon. Welcome to the Government House weekly press briefing for the week of March 9th, 2020. I am Government House Communications Director Richard Mota. We are here today to continue our efforts to provide the public with information concerning the administration's preparedness and response to the coronavirus, or otherwise known as COVID-19. Today you will hear from the Commissioner of the Department of Health, Commissioner Justa Encarnacion, Territorial Epidemiologist Dr. Esther Ellis, and DOH's Director of Public Health Preparedness, Ms. Francine Lang. Also, we have with us the Department of Human Services Commissioner Kimberly Kazi Gomez, and State Director of the AARP in the Virgin Islands, Mr. Troy D. Shabir Schuster. We also have with us to answer any questions concerning the territory's readiness and response plans, Territorial Adjutant General Kojo Knox Limbacher. But before I turn over the briefing to DOH, I want to point you to the official source of information from the government of the Virgin Islands concerning the coronavirus, and that is doh.vi.gov/coronavirus. I will repeat, that is doh.vi.gov/coronavirus, or you can text COVID-19 USVI to 888-777. And once you do that, you will get real-time updates to your mobile phone on the administration's response plans, or the administration's response to the coronavirus. So I'll repeat that again. That is COVID, spelled COVID-19 USVI to 888-777. And that'll allow you to get real-time, up-to-date information on the administration's response efforts to the coronavirus in the territory. So with that, I will turn over the briefing to the Commissioner of Health, Commissioner Justa Encarnacion. Thank you.
Thank you, Director Mota. Good afternoon, everyone. I want to assure you that the Department of Health has and will continue to prepare for any level of response needed surrounding coronavirus or COVID-19. We are asking all nonprofits, private, and our federally qualified health centers to continue partnering with us in educating their staff and the public. We ask that you educate your staff on the importance of protecting each other. If they are sick with a cold symptoms, for example, cold, cough, etc., use precautions like sneezing into your sleeve, washing hands frequently, and using hand sanitizers. If you have a fever along with the symptoms, you are encouraged to stay home. Importantly, routine cleaning and frequent cleaning of all surfaces in the workplace is definitely important and should be practiced on an ongoing basis. For our restaurants and our hotels, our Division of Environmental Health will be visiting you more often. They will be bringing flyers and posters and sitting with you, educating you so that you can then educate your staff and present that information to the public. You want to secure your staff, you want to protect and secure the public. You will be to our media support. We're asking for your assistance in getting the word out and help us to protect our community. We'll be sending you PSAs in the near future. I am sure that Janessa Ritter, our PR person, will make them informative and interesting to look at, listen to, and read. I thank you all for your support in the past and look forward to speaking with each of you as we combine our efforts in speaking to the public. Public health is our health. You will be hearing today from our territorial epidemiologist, Dr. Esther Ellis, who will be providing update on information on data from an international, national, as well as a local perspective. You'll also be hearing from our Director of Public Health Preparedness, Francine Lang, who will tell you a little bit more about what we're doing within the Department of Health to keep you safe. Dr. Ellis?
Thank you, and good afternoon. The Department of Health, along with other local and federal partners, are closely monitoring an outbreak of respiratory illness caused by a novel or new coronavirus caused by the SARS-CoV virus, and the disease is named COVID-19. The outbreak first started in Wuhan, China, but cases have been identified in a growing number of other international locations, including the United States. According to the WHO, in the past 24 hours, the total cases are 1,586 confirmed cases. The majority of these are in China, 80,859 confirmed cases, and 3,100 deaths in China. Outside of China, there are 24,727 confirmed cases in 101 countries and 484 deaths. In the United States, there are 164 total cases, 11 deaths, and 19 states reporting cases, according to the Centers for Disease Control. At this time, there are no confirmed cases of COVID-19 disease in the U.S. Virgin Islands. There have been 4 persons under investigation, or PUIs, and thus far, 3 have tested negative. Under the widened surveillance guidance, the Department of Health expects that there will be an increase in number of specimens to be tested. In accordance with the law and in order to protect patients' rights, no additional public health information on these PUIs will be provided. The Department of Health will continue to regularly update the number of PUIs and report any confirmed cases. Most often, spread from person to person is happening among close contacts, about 6 feet. Person-to-person spread is thought to occur via respiratory droplets produced when an infected person coughs or sneezes, similar to how influenza and other respiratory pathogens spread. These droplets can land in the mouths or noses of people who are nearby, or possibly be inhaled into the lungs. It's currently unclear if a person can get COVID-19 by touching a surface or object that has the virus on it and then touches their own mouth, nose, or possibly their eyes. Typically, with most respiratory viruses, people are thought to be most contagious when they are most symptomatic or the sickest. For confirmed COVID-19 infections, reported illnesses have ranged from people with no symptoms to people being severely ill and dying. Symptoms can include fever, cough, shortness of breath. For any suspect case, the Department of Health does have the capacity to collect samples for laboratory testing, and at this point, we're sending the samples off-island to the CDC for confirmation. If you or someone you know has traveled to a location with human-to-human transmission of COVID-19 within 14 days of becoming ill with fever and respiratory symptoms, call ahead before going to see the doctor or emergency room, and tell them your symptoms and where you traveled from. To report a suspect case, contact the Department of Health's Epidemiology Division at 340-712-6299. Again, that number is 340-712-6299 or 340-776-1519. Again, 340-776-1519. This is an emerging, rapidly evolving situation, and the Department of Health, along with our partners, will continue to provide updated information as it becomes available. Thanks.
Good afternoon, everyone. The Virgin Islands Department of Health initiated a partial activation of its Departmental Emergency Operations Center, or DEOC, in both districts at 3 p.m. on Monday, March 2nd, 2020. The DEOC conducts daily operations briefings at 9 a.m. each morning and update briefings at 3 p.m. The DEOC was established to track the many requests that have been coming into the Department of Health, as well as to document our activities and coordinate resources. Currently, our operations are from 9 a.m. to 5 p.m., with after-hours coverage being carried out by on-call personnel. If a confirmed case is identified in the territory, the DEOCs will convert to full activation, as established in our emergency response plans. Department of Health has been coordinating with VITEMA and the hospitals, and their liaison officers are joining our daily briefings starting today. DOH, in its efforts to continue our interagency collaboration in the territory, hosts a weekly interagency call on Fridays to provide updates and discuss new issues. DOH is continuously building capacity to prevent the spread of COVID-19 in our community, but is prepared to respond if it does occur. And I wanted to repeat our reporting lines: 340-776-1519 or 340-712-6299. Thank you.
Thank you both. One of the things we spoke of earlier is our vulnerable population, our aging population. And here with us today, you have the State Director of AARP, who will discuss from a statewide perspective, federal perspective, what you need to do and how you can actually prevent or mitigate symptoms and the COVID-19. Along with him, our own Commissioner Kimberly Kazi Gomez will speak with you a little bit more about what we're doing in our nursing home and the precautions that we're taking.
Thank you, Commissioner Encarnacion. I'm Troy Deshabert-Schuster, the State Director of AARP in the Virgin Islands. Older adults are particularly vulnerable to the coronavirus or COVID-19, especially those living in long-term care settings where patients are grouped in a communal setting and the virus can easily spread. According to the Centers for Disease Control and Prevention, the CDC, older people and people with underlying health conditions like heart disease, lung disease, and diabetes are about twice as likely to develop serious outcomes versus younger, healthier people. In the United States, the first deaths due to the virus were Americans over the age of 50. In China, data from China's National Health Commission shows that the majority of people who have died from the disease are over the age of 50. A study in the New England Journal of Medicine that analyzed the first 425 people with the virus found that the median age of patients was 59. You can learn more about the coronavirus at www.cdc.gov/coronavirus. Again, that's www.cdc.gov/coronavirus. As the world looks to contain the spread of the coronavirus, federal investments in diagnostics, treatment, vaccine development, outreach, and education, and timely and consistent public health efforts are imperative. Robust support and resources must be provided to states, the territories, and local communities, including healthcare professionals and first responders who are on the front lines of this effort. AARP has been working to promote health and well-being of older Americans for more than 60 years. In the face of this crisis, AARP is providing information and resources to help older people and those caring for them protect themselves from the virus and prevent it spreading to others. You can find AARP's coronavirus resources at www.aarp.org/health. Again, that's www.aarp.org/health. Be on the lookout for scams related to coronavirus prevention, protection, treatment, and even investment opportunities. For information, please see the Federal Trade Commission's website, which is www.ftc.org. Again, the website for the Federal Trade Commission on scams related to this virus can be found at www.ftc.gov. AARP has urged Congress to provide ample resources needed to combat the coronavirus disease and facilitate telehealth visits by those on Medicare. AARP supported a bipartisan agreement that Congress passed and President Trump signed into law on March 6, 2020, because it included AARP's priority requests that the bill provide robust funding, greater access to telehealth for those on Medicare, and protections to ensure access to any vaccines or treatments. In addition, we must ensure that any vaccine or treatment for this virus be affordable and accessible to all. Any vaccine, especially one developed with taxpayer dollars, must be priced in a way that ensures broad access. Vaccinations are only effective if all those who need it can afford to access it. Prescription drug reform will help ensure that any new vaccines or treatments for coronavirus or COVID-19 are affordable for all Americans. We continue to urge the Senate to take up the Grassley-Wyden bill and rein in the price of prescription drugs. AARP strongly urges the federal government to move as quickly as possible in deploying resources needed to combat COVID-19, as provided by the bipartisan coronavirus supplemental funding bill that President Trump signed on March 6, 2020. Robust support and resources must be provided to states, territories, and other local communities, including healthcare professionals and first aid responders who are on the front line. We must ensure that any vaccine or treatment for this virus be affordable and accessible to all. Yet, this is yet another example why Congress must act to lower prescription drug prices. There is nothing to protect Americans from the possibility that drug companies will engage in price gouging behavior, even during a public health crisis. Many residents of our territory are living in nursing homes and assisted living facilities. Older adults are particularly vulnerable to this virus, including those living in communal settings, where the virus may spread rapidly. AARP has been working to promote health and well-being of older Americans again for more than 60 years. And we thank Governor Albert Bryan, our Commissioner of Health, Justa Encarnacion, and our Commissioner of Human Services, Kimberly Causey Gomez, for leading us in this battle to protect us from coronavirus and prevent its spread in the Virgin Islands. Thank you.
Good afternoon. I'm Kimberly Causey Gomez, Commissioner for the Department of Human Services, and it's my pleasure to be here to present the Department's updated response to COVID-19. Our best defense against the respiratory disease is to know the facts about it, spread awareness and knowledge of its prevention, and to be prepared to act if there's suspicion of or a case in our community. Consequently, our goal today is to encourage our Virgin Islands residents to become very aware of the facts about COVID-19 and not to panic. As we've been sharing with our employees of the Department of Human Services and the clients that we serve, panic prevents you from thinking clearly, thus leading to unwise decision and extreme emotional distress. Instead, it's important to gain knowledge about COVID-19 and to follow through the appropriate actions to try to prevent the virus from gaining a foothold into our territory. It's also important to know the facts and updates that the Virgin Islands Department of Health, VITEMA, the Administration for Health and Human Services, Centers for Disease Control, and others continue to share daily and the action steps that can be taken if there's a suspicion or confirmed case of the virus in the territory. DHS is working closely and collaboratively with the Department of Health's lead epidemiologist to provide on-site training and information for our staff and the clients we serve. The DHS, by virtue of our local statutory and federal mandates, us to provide social services to persons across the life cycle, and our oversight and delivery of several federal programs, stands ready to collaborate with other central government agencies, semi-autonomous entities, private and nonprofit community agencies, and our federal partner agencies to ensure our most vulnerable populations will be able to prevent and to respond to the threats of COVID-19. Collaborative efforts with DOH, VITEMA, DHS is taking active measures to empower our staff and clients with clear guidance to prevent the spread of any acute respiratory illness, including COVID-19. Because DHS provides care and services to members of our territory's most vulnerable populations, including our seniors, we've been diligent in arming all of our staff with CDC, educational materials, messaging, and produce flyers on preventative hygiene and facts about COVID-19. Our goal is to enable all of our staff to spread factual information to our clients across programs. We are posting informational flyers and distributing hand sanitizer across all of our facilities, especially in our high-trafficked areas. We are following guidance from all of the HHS, CDC, DOH, and VITEMA. Additionally, DHS is working collaboratively with DOH and VITEMA to receive their support. Because DHS also operates 3 senior centers and provides outreach and support services such as Meals on Wheels, our Homemaker program, and our Family Caregiver Support program, our staff is distributing information on COVID with our caregivers and our senior citizens who are not residents of our homes for the aged but reside in our community. At this time, we are not restricting visitation on our homes for the aged. However, in the event, we hope that you're sensitive if you come to visit, and that if you have a cold, that you are not to visit. We will be making sure that when you come and you're signing in as a visitor, if you're coughing or presenting any issues, we will not allow you to visit at that time. At this time, we're also not closing our senior centers unless the case is in the Virgin Islands. We're providing timely updates and age-specific information about the virus with our seniors and persons of disabilities, which we will receive from our federal partners. Also, through Act number 8058, the Department of Human Services is charged with the establishment of a registry for persons 60 years old and older with disabilities living alone during times of a disaster. This registry is both voluntary and confidential. DHS, the Bureau of Motor Vehicles, and the Virgin Islands election system encourages that all persons enter their names on a registry with the respective entities so they may be contacted to determine if they need emergency assistance during a man-made or natural disaster or in the event of COVID-19. If you have any specific information or would like to register, please contact the Department of Human Services, 774-0930, in St. John, 776-6334, and St. Croix, 773-6630. Another vulnerable population is our young children, who are in our infant and toddler care and our preschool programs that include our Head Start program children. We actively promote within the Head Start program the following best practices, which are encouraged by the Department of Human Services, Department of Health, and the schools. Hand hygiene, respiratory etiquette, routine cleaning, and we separate ill students and staff. And if you're sick, please stay home. The Department of Human Services also has the Office of Child Care and Regulatory Services, which licenses all child care programs, private and government operated, and we're coordinating a teleconference for child care providers this week to share the information about COVID-19. The child care providers can provide information in an session without having to close their facilities. Teaching children about the importance of frequent hand washing for 20 seconds, making it fun for them by encouraging them to sing happy birthday, will be helpful in this instance. If you are a child care provider and you have questions, please do not hesitate to call us at one of our offices. If you're also a child care provider and that you feel that something is presenting symptoms, please do not hesitate to call the Department of Health at the numbers listed below. I encourage you all to get familiar with the facts and the signs and the symptoms. Take care of your health and the health of your family through healthy eating, good rest, and proper hygiene. Reiterate, the Department of Human Services stands ready and prepared for our most vulnerable populations. And if you have any questions, do not hesitate to contact us. Thank you.
Thank you, Commissioner Kazi Gomez. At this time, I will open to questions from the media, but before we go to the questions, I just want to reiterate where the public can get information on the territories or the government's response to the coronavirus, and that is, again, at the Department of Health's website, so that's doh.vi.gov/coronavirus, or you can text COVID-19 USVI to 888-777. I will repeat, the website is doh.vi.gov/coronavirus, and for push notifications, you can subscribe by texting COVID-19 USVI to 888-777. So I will open it to any questions from the media at this time.
Hi, good afternoon. This is a question for Esther Ellis. Hi, good afternoon. How are you doing?
Good, thank you.
I'm wondering, what's the availability of testing kits and how long does it take to get information back on a test kit that was sent out?
Okay, we do have, what you need to conduct a test or a swab, so it's an NP swab, a nasopharyngeal swab, or an OP swab, an oral pharyngeal swab. We do have the capacity to do those sample collections on island. We have received the test kits that the CDC is making for states and territories to our territory, and we're in the process of validating that test kit, and as soon as it's validated, we will be able to do the test on island. At this point, we are mailing any samples that need confirmatory testing to the Centers for Disease Control, and the turnaround time has been about 3 days, 3 to 4 days.
And then, I understand that you've been having weekly meetings that involve the hospital and everything. One issue that the hospital has is that they can't create a secure environment, mainly due to infrastructure issues like their bathrooms in the emergency room. They can't secure the facility. How does that impact your planning for if there was an epidemic, not being able to use the hospital to its full capacity?
That's definitely been taken into consideration. We have partnered with agencies that regularly transport patients off island and identified that they will be able to transport off island as well as where patients might be transported. And we've also been working to identify alternate locations if we were to require a larger quarantine space.
Good afternoon. If I may also add to that, we know that we actually have to secure the patients and stabilize them and ensure that we place them in isolation as they may come. So we're working very closely with both hospitals to secure an isolation room and several isolation rooms actually on both districts to properly place them, separate them from others, test them, and care for them in whatever level of care that they have. And yes, we are actually in the process of working with the Federal Department of Health and Human Services to ensure that we can actually transport those patients as soon as possible into a more secure area outside of the territory.
And I just have another question. It's not exactly related to COVID-19, but it has came up recently. The union, the Seafarer, they sent out a letter about the EMS that were transferred to work at two fire stations on island, and someone got sick from breathing in rat urine. I was wondering if you had a comment to that. They issued several demands in their letter, and I was just wondering what the status is on that.
I think that there was some mold in one of the areas, and of course, everyone reacts differently to the level of mold, and one of our staff members actually did feel a little sick after staying within an area. So what we've done is that we've actually went and we did some surveys at not just one, but all the fire stations. And so we're in the process of working very closely with Director Darrell George, who has been very cooperative and assisting with us. And now we're cleaning all the areas up that we need to, and we'll be prepared to send our EMS staff back in as soon as we can.
Let's go with the consortium. And for you, Commissioner Dr. Ellis, I'm following on the areas of the hospital that you guys are working on to prepare for possible cases. You said you're vigorously working at that. When will they be ready, or have they been ready? Those places in the hospital.
St. Thomas reported that they have between 6 to 8 beds that they can actually have available right now. St. Croix has 1 bed. However, we can always make changes if we need more beds. As of the 11th of March, coming soon, they will reopen up their ICU unit. That actually provides for 12 beds. So we can actually shift if we need to. So there's never, you can always make a difference. You just have to make sure you're diligent, and we're working very closely with the hospitals. We're also providing them a very strong tent that we received after the storms. We're going to purchase accessories for those tents that create a negative pressure barrier and increase the isolation or quarantine capability. So we have 2 of those, and they will be placed close to the hospital, which would allow them to provide the care that they need.
Thank you. I know Dr. Ellis said results or possible cases take 3 to 4 days to come. When was the last possible case sent, the PUI, and when do you expect it?
I cannot give any additional information about the PUIs to protect the privacy of all individuals being tested. We want to encourage individuals too that it's safe to get tested, that your privacy will be protected.
You think, given the information on when you expect it back, will be too much information?
Sometime this week.
Sometime this week. Okay, and on that, to that end, I know you said you're not going to give too much more information. I had a question about back in the day when Zika and chikungunya was out and you guys sent out information, you would send weekly updates as to a breakdown in the territory. Whether it's St. Croix, 5, 10, St. Thomas. Are we not going to get the same information as to the breakdown in the territory for coronavirus?
Yes, once the numbers are higher and it wouldn't be identifying for individuals, we will be releasing weekly reports again in that same format. The providers, our stakeholders, the community really appreciated getting those updates. We also posted them on our website, and we will do that again.
Okay. Another question as it relates to the PUIs, the persons under investigations, possible cases. Are you in touch, since we don't know, I mean, now we know that 3 have returned and they are negative, but since you don't know, are you trying to, or have you been in touch or trying to get in touch with the persons that they might have been in touch with, in terms of to find out whether, I'm trying to understand, what is the scope of the investigation, the quarantine, the effort that you guys have put up?
We have treated every PUI as if they could be a case until we get the result back.
Excellent. Thanks for that. And I had one more question on coronavirus and additional steps. But yeah, thanks for that. I can't remember the last question. I'm sorry. Richard? Oh, I remember. Rich? Yes, it's for Human Services Gomez. I need clarification. You said something about you're not yet closing the senior citizen facilities. I just need clarification, I'm not sure if I heard correctly. Are you saying that if there was an outbreak were to occur, that you would move to close those senior citizens?
Well, it would be a discussion. At this time, we're not closing the centers. What would do, it would encourage the isolation of our seniors, and since we don't have an outbreak, it doesn't make sense for us right now. In the event that that happens, or in the event that there is a senior that has been diagnosed with COVID-19, that would be a discussion that we'd have to have. But right now, our senior centers are open.
And since you're here, I know you mentioned about, visitors coming to senior centers and, if you feel like you have a cold and cough, how strict are those protocols that you have in place related to visitors?
We have a policy and procedure in place, and so anybody that's coming into the facility now, especially at Herbert Grigg Home for the Aged, making sure you have a mask and gloves. And if you really have symptoms, we are not letting you in.
And relative to gloves and masks, does the Department of Human Services, you got, how many do you have? Do you have a staff?
I don't know how many we have. I don't know if I have 3 or 27. We're definitely working with Department of Health. I spoke with Commissioner Consortium earlier that we need additional supplies.
Have we estimated how many of that we're going to need, Department of Health, in terms of protection?
We actually spoke of that today. So what we're doing is that both hospitals, right now, they're the ones who are procuring a lot of the PPEs, because they're the normal person who would. So we're allowing them to continue to do that. And so as of today, they're going to provide a spreadsheet of their actual numbers. That will be transmitted to our EOC, and both, we have an incident commander and a deputy incident commander, one at St. Croix, one at St. Thomas. They will review them on a daily basis, and as Director Lang said, we now have a meeting every day at 3, and the liaison from hospitals as well as other agencies will be reporting, and those are some of the numbers they'll be reporting. And so we're also working with Department of Human Services federally, and they would be assisting us to ensure that we have the appropriate PPEs needed.
And last one for the Department of Health. I realize there's a strong defense in here, so in the sense of, an outbreak occurs, one case possible, then we have things in place.
Correct.
I was trying to understand what is there any offensive game there? So how do we quite know if we have a case or two? What steps are we taking to say in the community? I know you're encouraging folks to stay home, self-quarantine, if you feel like you have a cough, and call the Department of Health. Are there any other steps, initiatives we're embarking on to trying to root out to see if we have any cases in the territory? No. All right.
Well, it actually goes with symptoms, so we have to wait until they come to us. Like any other diagnostic measures, that the patient actually has to come to you, as well as they can come to you themselves, or one of their employees, their staff members can say, you know what, I see what you're doing, I see your symptoms, I think that maybe you can. And we've actually had individuals call and say, I have a concern with this friend, or I have a concern with this staff member that's working with me. And then we help them based on they calling the number. We want to reiterate that it's important. We do have a straight line, both on St. Thomas and St. Croix, and we will get back to you.
Thank you. 2 more questions. One for, thank you, Commissioner.
You're welcome.
One for Mr. Schuster. For your members, your AARP members here, you have supplies ready for them, or did you mention something like that?
No, we don't have supplies in-house, but we do work closely with the Department of Human Services and the Department of Health, and so we can direct our members that way if need be. But we do provide lots of information on our website at aarp.org regarding this coronavirus, COVID-19.
All right, and lastly for the Attorney General here. Sir, I know the Department of Health is working with the 2 hospitals, and the governor mentioned the quarantine zone at the National Guard. You want to give an update on that?
Yeah, right now, until we actually have an actual declared emergency, whether it's from the governor for locally or a federal requirement, once that requirement comes to the National Guard, those are federal buildings. So we will have to elevate that to our service secretary, Secretary of the Army, Secretary of Defense, to get authority to use any of those buildings for that. My primary focus is one, ensuring the safety and security of my personnel, that are protected, so they make sure they have the right protective gear should that happen. Also making sure that they're ready to respond for the requirements of both the governor and the federal entities. And then also understanding that trigger will come with a federal requirement, so the Department of Health and Human Services federal will come into play with that. So right now, no request has been done. We've been doing extensive planning to make sure, should that call happen, we can respond. But as today, right now, the request has not come.
What would be the turnaround in case the request comes?
So essentially, if the request comes and we get the authorization from the federal emergency happens, so as fast as that can happen, it's literally a phone call or a directive to me from the federal entities in my chain of command from a federal standpoint to make that happen, and my folks are ready to make that happen well within 12 hours.
12 hours, to be clear, have an area within the national guard